Good morning, guys and teacher. This video is about chapter number 3, Preexcercise Evaluation, of the book of American College of Sport Medicine. It is made by Paola Castiblanco and Shakira Quintero. This chapter contains very useful information such as informed consent procedures, medical assessment of cardiovascular disease and history risk factors, physical examination and laboratory tests, instruction for participants related to both health, fitness, as with clinical exercise settings. If a person requires the prescription of exercise, a pre-exercise evaluation should be performed that includes a physical exam, an exercise test, and/or test to verify a person's health status or require additional information to design the routine of exercise. A comprehensive pre-exercise evaluation in the clinical setting generally includes a medical history and assessment of risk factors, physical examination, and laboratory tests, the results of which should be documented in the patient file. Obtain adequate informed consent from participants prior to exercise testing in health fitness setting is an important ethical and legal. Although the content of the consent might vary, there should be sufficient process information to determine that the participant knows and understands the risks associated with the test or exercise program in health, fitness, or clinical settings. The consent forms must be explained verbally and include a statement indication which patient has had the opportunity to ask questions about the procedure and has enough information to give informed consent. Note the specific questions from the participant on the form along with the response provided. The consent forms must indicate the participant is free to withdraw from the procedure at any time. If the participant is a minor, a legal guardian or a parent must sign the consent form. It is advisable to consult with authorized bodies to determine what is the appropriate form or an acceptable informed consent process. To correctly fill out the informed consent for an exercise test it recommends 1. Explain clearly to the patient what is the purpose of the test and the explanation of the procedure to be performed. 2. Tell the patient that during the test some changes might occur that lead to a risk, but that he has the equipment and personnel necessary to act in the emergency. 3. The patient must report every sign related to their health status and medical history. 4. The patient should be informed of the benefits of performing the test for prepared diagnostics. 5. Any question or doubts the patient has should be clarified. 6. These results should be recorded correctly in the patient's medical history. And 7. The patient must freely sign the consent if they agree with it.
Medical history and cardiovascular disease risk factor assessment. The pre-exercise medical history should be drawn and include past and current information. The appropriate components of the medical history are present in both 3.1, although no longer part of the exercise participation health screening process, identifying and controlling CVD risk factor continue to be an important objective for overall cardiovascular and metabolic device prevention and management. qualified exercise or health care personnel are encouraged to complete a CVD risk factor assessment with their patient or client to determine in the individual meet any of the criteria of CVD risk factor shown in the table. A continuation. In the present of advance of the CVD risk factor is not disclosed is not available that CVD risk factor should be counted or risk factor for the patient or client education and the lifestyle counseling. It's common practice to zone the number of positive risk factors because of the cardioprotective effect or high density protein cholesterol is the considered a negative CVD risk factor. For individuals having high density protein cholesterol or one positive CVD risk factor is subtracted from the sum of positive CVD risk factor. Component of the medical history. Appropriate component of the medical history may include the following: medical diagnosis and history of medical procedure, cardiovascular disease risk factor including hypertension, obesity, dyslipidemia, and diabetes. Cardiovascular disease including heart failure, valvular dysfunction, myocardial infarction, and other acute coronary syndromes. Previous physical examination finding murmur, clicks, gallo reading, others abnormal heart sound, and other unusual cardiac and vascular finding, and abnormal pulmonary finding with real crackers, high blood pressure, and edema. Laboratory finding plasma glucose, serum lipids, and lipoproteins, and other significant laboratory abnormalities. History of symptoms including discomfort, pressure, tiny sensation, pain, heaviness in the shank, head, neck, back, or arm, and others. Recent illness, hospitalization, new medical diagnosis of surgical procedures, orthopedic problems including arthritis, joint weakness, any condition that will make ambulation or use of certain things modalities difficult. Medication use, other habits including caffeine, alcohol, tobacco, exercise history, information on readiness or change and habitual level of activity, frequency, duration of time, type, and intensity. Work history with emphasis on current unexpected physical demands, and family history of cardiac, pulmonary, or metabolic device, stroke, and sudden death.
If warrants, a preliminary physical examination should be performed by a physician and other qualified health care providers. In the components of the preparation physical examination, following: body weight in the many instances, determination of body mass index, waist guilt, and or body composition, apical pulse rate and read blood pressure, auscultation of the lungs with specific attention to uniformity of varied sounds in all areas, palpation of the cardiac apical impulse and points of maximal impulse, auscultation of the heart with specific attention to murmurs, gallops, clicks, and rubs, palpation and auscultation of carotid, abdominal, and femoral arteries, evaluation of the abdomen for bowel sounds, mass, visceromegaly, and tenderness, palpation and inspection of lower extremities for edema and presence of arterial spools, absence or presence of tendon xanthoma and xanthelasmas. Blood pressure. Measurement of resting BP is an integral component of the pre-exercise evaluation. Subsequent decision should be based on the average of two or more properly measured sage BP ranges record during each of two or more of visits. National Committee of Prevention, Detection, Evaluation, and the Treatment of High Blood Pressure, the recently published 2014 evidence-based guidelines for the management of high blood pressure in adults, specifically doesn't address the classification of pre-hypertension or hypertension in adults, but rather recommends thresholds for pharmacologic treatments. Thus, the scheme proposed by the GNC remains a widely accepted classification scheme for recommendation on specific medication used in the management of hypertension in adults. GNC and the American Society of Hypertension and the International Society of Hypertension Clinical Practice Guidelines. There is evidence of an association between elevated triglycerides and CVD risks, although adjustment for other risk factors, especially HDL-C, appears to attenuate this relation. Non-fat triglyceride levels have a strong relationship with CVD risks than do fasting levels. Studies suggest some species of triglyceride-rich lipoproteins, notably small, very low density lipoproteins, VLDLs, and intermediate density lipoproteins, EDLs, promote atherosclerosis and predispose to CVD. Because VLDL and EDL appear to the atherogenic potential similar to that of LDL non-HDL-C. Is recommended as a secondary target of therapy for individuals with elevated triglyceride levels. When the triglycerides are more 500 mg, they become the primary target of therapy due to the increased risk of pancreatitis.
Well, in continuing with physical exam, blood profile analysis. Multiple analysis of blood profiles are commonly eventually in clinical exercise program. Such profile may provide useful information about an individual overall health status and ability to exercise, may help to explain certain ACG abnormalities. Because of varied methods of assessing blood samples, some caution in advances when comparing blood schematics from different laboratories. For many patients with CVD, medication for dyslipidemia and hypertension are common. Many of the medications act in the liver to low blood cholesterol and the kidneys to low VD. Although current recommendation to do suggest performing serial tests of liver function in patients presenting syndrome, tests such as alanine transaminase and aspartate transaminase may indicate the presence of liver abnormalities induced by the agents. Periodic tests of renal function with tests such as creatinine stimulate glomerular filtration rate, blood urea nitrogen, creatinine radio, and serum sodium and potassium level is indicated in the patient prescribed medication that may lead to alteration in renal function. In pulmonary functional testing with spirometry is recommended for all smokers greater major 45 years old and any individual presenting with dyspnea, chronic cough, wheezing, or exacerbates mucus production. Spirometry is a simple and non-invasive test that can be performed easily. Indication for spirometry are in continuation. When performing spirometry standard for the performance of tests and endorsed by the American Thoracic Society should be followed. Participant introduction. Explicit introduction for participants before exercise testing increase text validity and data accuracy. The following points should be considered from including in such preliminary instruction. However, specific instruction vary with the test type and purpose. At minimum, participants should refrain from ingesting food, alcohol, or caffeine on using tobacco products within 3 hours of testing. Participants should be rested for the assessment, avoiding significant exertion of exercise of the day and the assessment. Clothing should permit freedom and movement and including walking and running shoes. Women should bring a low 15 short sleeving blouse that button down the front of should avoid restrictive undergarments. In the evaluation, if on the on-page brands, participants should be made aware that the exercise test may be fighting. They may wish to have someone accompany them to the assessment to drive home afterward. In the exercise test is for diagnostic purpose. It might be helpful for patients to discontinue prescribed cardiovascular medication, but only with physical approval. Currently, prescribed antianginal agents alter the hemodynamic response to exercise and significantly reduce the sensibility of ACJ change of ischemia. The exercise test is for functional or RX purpose. Patients should continue their medication regimen of their usual scale of the exercise purpose with considered with response expected during exercise training. Participants should bring a list of the medications, including dose and frequency of administration to assessment, and should report the last actual dose taken. As an alternative, participation may wish to break the medication of the exercise testing start a record. Participants should be instructed to drink ample fluid over the 25-hour period present the exercise text to ensure normal hydration before texting.